So an important reminder about UHealth plans, all U plans offer coverage that go beyond the essential health benefits required by the ACA. In Utah, some carriers offer basic plans that meet only the minimum standards. So just those required items, but our plans are designed to go way beyond those basics. We include additional benefits other carriers may not. All U plans include the same benefits, making it easy for members and brokers. No guesswork, just consistent, reliable coverage. So you don't have to remember which plan had an eye exam added or this added or that added. All of our plans cover everything the same. So some of the additional benefits that our plans cover, we've added annual adult preventive eye exams to every individual plan. So not only pediatric vision exams are covered, but the adults can go in for their annual visit as well. Sleep studies are covered on our plan. CPAPs are covered on our plan. BiPAP therapy, a lot of durable medical equipment, like mobility aids, like wheelchairs, walkers, canes, allergy testing, and prosthetics are covered on all of our plans. Now, some items do require prior auth, and you can give us a call and we can look at those and let you know which items do require that. If you have someone moving from another carrier to a U plan and they want to confirm coverage for specific services, if you can have them request the CPT codes their provider is currently billing, and then just call our customer service at the 801-213-4111 number. Our representatives will look up the service, let them know if it's covered or not, and if it needs prior auth. We want to make sure your clients have peace of mind before moving over to a U plan. And of course, we want to make sure our plans are the right fit for the member as well. So I'm sure you guys have heard Aetna is exiting the ACA in Utah and other states in 2026. So here's what you need to know for Utah, for those Aetna folks. When Aetna members are transitioned, they will be crosswalked to the lowest cost plan available in their service area by metal level. And so most of those people will be moved over to a select health plan, but our network is actually more in line with Aetna's network. And so it actually would make more sense for them to be moved over to a U plan. So just make sure that if you're working with people that are on an Aetna plan, if they want to keep their same doctors and their same U of U providers, make sure that they know if they're okay with changing providers, they'll be moved to a select plan. But we'd love to have all of those members moved over to us. We'll take really good care of them. And again, our network is more in line with Aetna. So we think it's a really big opportunity for us to grow and for you. And we have a bonus that I'll be talking about in a bit as well. So if you move those folks over to a U plan, you may earn a little bonus. At the U, we're really committed to helping Native American and Alaskan Native Utahns access health coverage. Our focus is on increasing awareness about eligibility for programs like the Indian Health Services and leveraging the Affordable Care Act plans to connect individuals with plans tailored to those tribal communities. Through the marketplace, these consumers have access to special enrollment periods that allow them to enroll any time of the year. They don't have to wait for open enrollment. So that's really nice. They have low cost or no cost plans. The coverage complements the Indian Health Services that they're receiving currently. We're going out to a lot of the tribal areas and doing presentations. And what we're running into is that people are thinking, well, I already have providers at the Indian Health Service. Why do I need insurance? I can just get free coverage there. But they don't realize that they can see their IHS providers, they can see the U of U contracted providers, or both. They don't have to choose one or the other. So that's the biggest misconception we're running into. And we have a lot of Native American Indians communities in Utah, and most of those folks are not insured, and they just don't know about the plans. So we're really trying to educate the consumer about it. So make sure you're familiar with the zero cost and limited cost sharing plans, because you'll be running into that with our Native American communities. For the zero cost sharing, if they have an income between 100 and 300% of the federal poverty level, the plan doesn't cost them a thing. No out of pocket, no co-insurance, no copay. So it's really great they have this. If they go out of the state, they'll have emergency care, and all of the other benefits that come along with health insurance that they don't have now by just seeing their IHS provider. And those that don't qualify for the zero cost sharing, there's a limited cost sharing version, which is available to all tribal members at any meta level, regardless of income or if they get an APTC or a tax credit. So really great plans for those folks. So just the key takeaways, remember we have just under 20,000 providers in our network, and it's not limited to U of U providers. Really important if you're talking to those Utahns that ask about that. We have our zero deductible off exchange plan. And remember, all U of U plans cover services beyond the required essential health benefits required by CMS. So make sure if you have any CPT codes or anything we can look up for you, let us know and we'll make sure our plans are a great fit for your client. And just remember to inform those Aetna folks about upcoming network changes. I would hate to see Aetna people are thinking the marketplace is just moving them to a new plan, and then they go and have an expensive surgery or service done and then find out, oh man, I'm in a totally different network, and then they have those out-of-pocket costs. So just make sure your Aetna folks know about those network changes. We did create our own pharmacy benefit manager called RealRx to save our members pharmacy costs.